When you go to the Hill and you are given oversight from various congressional committees, do you get the sense that there is a community of spirit of we would like to have health care for American people?
You know, I think that the Affordable Care Act is a completely unique part of the portfolio of HHS in terms of how politicized it is. And it is very difficult to move the conversation from three words, you know, Affordable Care Act, or some use another phrase, Obamacare, to the substance of the issue. And that is a place that I think is harder than many of the other issues that I work on a day-to-day basis, whether that's Ebola or a number of the issues of the department, opioids, in terms of all the work that we do in that space. And so this is a place where it is particularly and uniquely hard. However, the place in is a place where reforming the healthcare system, you can sometimes have the conversation.
So as you think about the total spectrum of what it is you do, do you wind up spending a disproportionate amount of time on the ACA?
You know, during my time, and so I've really only been at HHS for a little over 2 years.
Right.
So I got there, I was confirmed June 9th of 2014, to give you a sense of it. It's been a relatively short period of time. And the question of disproportionality, we've had a number of crises. In addition, I think probably, and when I went over to take this job, I thought the answer to that question would be yes, hands down. And it still is yes, but at HHS during my time there, we have had Ebola, we have had Zika, we have had 50,000 unaccompanied children that came across the border from southern countries, across the United States southern border, and those children come to the care of HHS. And so there have been a number of issues that probably also have taken disproportionate time. But certainly, I do spend a lot of time on the Affordable Care Act, and that's both the issues of access, affordability, and quality, because that's what the act was about. And so spend time on all of that.
So I want to dig into the ACA here a little bit, and then we'll move on to some other stuff, because you know your portfolio is global. What is the biggest thing yet undone in your eyes to get the ACA to where the Obama administration wants it to be?
So interestingly, I would answer that question with the biggest thing that needs to be done is to get to the place where we can do what you just asked about in your first previous question, which is getting the place where we can actually have a dialogue about how to improve, about how to build on, because that's a conversation that has not been had in Washington. And with that conversation will come things. There will come big things and small things. So small things. The definition of Native American is not correct. In the Affordable Care Act, it's different in different places, and that causes a lot of implementation problems. Even small things like that, we haven't been able to fix. There are what I would call larger things. The tax subsidy for small businesses is probably not large enough for those small businesses to do uptake. And so we've proposed that for a number of years, but hasn't taken. And then there's sort of the very big issues. And in the United States, in healthcare, there are markets where you do not have a lot of competition of providers, in other words, doctors and others, and then you don't have competition of insurers, and that existed before the Affordable Care Act. And there's been some progress in that space, but that's a big space that you'd want to focus on with a dialogue about how do we solve some of these issues, especially in rural America or in places like Alaska, where there's not a lot of competition or therefore a lot of services for the people.
How much of what you have left to do is, in essence, a marketing job, an outreach job, to make sure that the 10+ million people who are not yet in the exchanges or covered somehow get there? Because it's not possible that they're not seeing the message, right?
So I think that the job there are two parts of this that are left undone. And the one is, how to get the change. There are three things. How to get the changes, right. And that's what I just spoke to. The marketing issue, interestingly, I think is actually as much about making sure people understand the broad benefits of the ACA. And let me be specific. I feel pretty certain that everyone in this audience knows somebody with asthma or who has had cancer or some other pre-existing condition. And only since the Affordable Care Act do you not need to worry if you're ever going to have a moment where you would go from one job to another and perhaps have a break in that coverage, because pre-existing conditions no longer can keep you out of insurance. In this audience, I'm looking and I'm seeing probably actually about 50% female. No longer can I be charged more than you can be charged for our insurance policies. No longer, if you go, and whether it's all the preventative services that no longer require a co-payment or additional payments. And all of those benefits to the marketing issue you're raising, many people don't recognize or understand. Or, I've met the kid who at the age of 19 had hit their lifetime limits because they had very severe cancer. Can you imagine? You're 19, and because you have survived cancer, you have hit your lifetime limit of insurance. You can't be insured. And so no more lifetime limits, no more annual limits. The benefits broadly, and I think that is a part of the marketing, is making sure that people understand that. The second part is there's more substance to be done in the areas of access, affordability, and quality. In access, we still have people, as much progress. In the nation, it's historic. Those 20 million mean that for the first time in our country, under 10% of the people are uninsured, but there's more progress. 31 states have expanded Medicaid, but there's more. We have another open enrollment that'll start November 1st to try and make sure we enroll more folks. In the areas of affordability and quality, I think people still struggle. While costs have grown slower, so we've had the slowest price growth in healthcare that we've had in 50 years. We've seen Medicare per capita costs grow more slowly than we've seen. And in the employer-based market, 4 out of 5 of the slowest growth years on record in terms of premiums that employees pay are the slowest. But there's more to be done there. And that is a part of the work that we'll do over the next 6 months.